Fantastic. If you're just showing up, feel free to introduce yourself in chat, but we're going to go ahead and get started. So, welcome to the Let's Make Universal Healthcare Happen virtual town hall put on by Whole Washington for universal healthcare here in Washington State. So, a little bit about me. My name is Thomas Kennedy. I am a mostly lifelong Washingtonian. I live in Seattle. I have a bachelor's in electrical engineering, a master's in teaching I got not long after. I was only an engineer for about 2 years. And then I spent 11 years as a high school math teacher before some disabilities, notably my feet, kind of knocked me out of that profession. And then I've been volunteering with Whole Washington for the last 2 years. I am the social media lead. I'm on the 501c3 steering committee and a bunch of other stuff, including being a policy co-chair for our coalition, Healthcare is a Human Right. So a little bit about Whole Washington before we start. Andre Stackhouse is our executive director. He lives in Seattle. He studied information science, was a professional software engineer, but he's been our executive director since I've been a part of the organization, so for over 2 years. And before that, he had led initiative campaigns that we had done. I believe he was the lead on the 2022 initiative. Our board chair is Carrie Wallace. She's from Castle Rock, Washington. She's been a registered nurse for over 20 years. She's a dues-paying member of both WSNA and National Nurses United. And she's been a Whole Washington signature captain and volunteer since the very, very beginning in 2016. So, what is Whole Washington? We're both a 501c4 political nonprofit and a 501c3 charitable nonprofit. We get that through Sustainable Seattle, our fiscal sponsor. We're the authors of the Washington Health Trust, which is the only universal healthcare bill in the legislature. We're the largest universal healthcare group in Washington, and we're the only universal healthcare group actively building a ballot initiative campaign. We're also members of the Healthcare is a Human Right Washington Coalition. So we have several powerful teams at Whole Washington. So to get an idea of our organizational structure, we have a powerful communications, social media, data and tech team, legislature team, regional leadership, fundraising, and I didn't put on here, but we've actually spun up our initiative team in the last few months to get ready to get on the 2028 ballot. We also have strong regional teams across the state. Instead of that list, I can show you here. These are the counties in which we have a strong regional team and a page set up. We also have a partnership with my friends at Yakima Valley Healthcare Defense Partnership in Yakima on top of this. So a little bit about the Healthcare is a Human Right Washington Coalition. It's a grassroots community labor coalition with 44 member organizations, or it's about 40 right now, member organizations, and 20 allied organizations. Whole Washington is a dues-paying member and a voting member of their steering committee and pretty much all of their committees. These are all four of the committees at Healthcare is a Human Right, and our executive director, Andre, is co-chair of the steering committee. I'm co-chair of the policy committee. Two Whole Washington volunteers, Sherry McAvoy and Jane Grafton, are co-chairs of the Hux committee. And the labor table that we have through Healthcare is a Human Right is co-chaired by our board chair, Carrie. So our board is very involved. What is Hux? That is a great question. They work with our Universal Healthcare Commission here in the state, which meets in Olympia at the Healthcare Authority's offices. And so I actually don't know what Hux stands for, but I know they work with the Universal Healthcare Commission. So what brings you here today? Does anybody have
I
shares
know
about? Oh,
you're probably still thinking about this, but to help Julian plan, do you know if you're going to go on Saturday or Sunday?
oh, I think Rachel doesn't know her mic is on. Uh, so, what brings you here today? Does anybody want to share what brought them here today? I can share that I'm presenting. That's why I'm here today. Uh, Anybody want to go next? Feel free to raise your hand or put it in chat. No brave souls. Yeah.
I'm happy to share.
Oh, sure. We'll go Ryan and then Gretchen.
I'm here because one, I am a big proponent of universal health care in a general sense, have been for some years, and currently I am involved in a Senate campaign for the state of Washington, and I just wanted to make sure that outside of my following on social medias, that I was here to get a little bit more in-depth information about where you stand today and some of the things that are needed to help push this across the floor.
Well, awesome. Thank you so much for being here, and thank you so much for running for office. Uh, and I hope you learned what you want to learn. Gretchen, go ahead.
I'm here because I have been involved with our rural hospital, and which was a terrible segue to universal care. And I'm a big proponent, so I want to see what I can do to help.
Thank you for being here. Deb, go ahead.
I just wrote in the chat that I'm a retired medical provider, and I've personally believed in universal health care ever since I went into medicine, and I still believe in it. So I think it's the best care we can offer.
Thank you. Other Deb, do you want to say something now? Hmm. Can lower the hand. And I will read a couple things in the chat. Healthcare costs are crazy. I'm paying $1,000 a month right now. Yeah, that's criminal. Uh, Jess is here to support getting universal health care, as I'd expect. Mary's here to support me. Aw, that's so sweet. And universal health care. Nice. Uh, Anna's here representing PV. I thought I recognized your name. Yes. We love Progressive Victory. They're one of our allies. So thank you for being here. Deborah shared out loud. Michaela, I'm on the email list. I'm here to learn more about the steps that have been taken so far and the remaining steps to push universal health care forward. I work with a lot of teens and encourage them to be more politically involved, but I don't practice what I preach as much as I should. So I'm trying to be more involved in things. Fantastic. Thank you. I know it's hard to do both at the same time. I'm here to learn more about the proposal and possibly help. We would love your help. Matt is here because he's awesome. Matt Wright is our King County lead, and he is a tabling whiz and just a wonderful human being. Lizzie Clausen, I'm already a whole Washington volunteer, and I want to make sure I'm up to date on what we're doing for leading county meetups. That's fantastic. Yes, get the kids involved. I totally agree. Washington Bus is another one of our close allies, and they do a fantastic job of getting the high school students engaged in politics and speaking uh, in Olympia, which is fantastic. Have not been able to attend the initiative meetings, but wanted to get involved. Fantastic. Healthcare is the great equalizer, and we must do better. I agree 100%. Well, thank you everyone for these incredible shares. There were so many interesting things put in chat. I appreciate the feedback. Washington Post is a great crew. Love those guys. Yep, for sure. So, what's the problem with our healthcare system? I'm going to breeze through this fairly quickly because it is very obvious for most of us who are here. It's too expensive. The amount of increase in our healthcare system is about 2 times what it's been in the rest of the world. And even adjusted for inflation, it's more than 7 times since 1970. That is unreal. The premiums have gone up by 365% over the past 26 years. Also unreal. And this is employer and employee side premiums. So it's just the cost of healthcare. The US is absolutely an outlier when it comes to healthcare spending, and it wasn't always this way. The US has always been expensive, but back in 1980, we were actually tied with the top players, and we have diverged since then. And what's the reason for this? It's privatization. It's private companies exploiting the need people have for healthcare. and profiting off of it. And we've seen more and more and more private companies snaking their way into Medicare Advantage, into the Medicaid MCO model, and so on and so forth through our system. And despite spending more than every other country, we have actually plateaued where other countries continue to see increases in their lifespan. And this is, again, because private insurance companies are absolutely taking advantage of the system and basically killing low-income people. The United States has the highest healthcare administrative costs per capita compared to other OECD countries. We're actually more than 5 times the average. And this is the amount of waste that happens in our system because hospitals have to talk to insurance companies, which then have to talk to people. And that process, if we cut out the middle, would be so much more efficient. And we aren't actually benefiting from the private insurance model. I love this graphic because it shows that universal healthcare does not need to lead to wait times. These bars are the wait times. And if you look, the United States is actually fairly competitive with many of these other countries that have universal healthcare. People use Canada as an example of terrible wait times, like that's the only way socialized medicine can go. And that is incorrect. Canada has the worst specialist wait times in the world, and they're working on it right now. So these are getting better. And what they have is too few doctors. Other countries with socialized medicine have more doctors per capita and thus have shorter wait times. It's almost like supply and demand works, and it doesn't matter which system you're using. And maternal mortality in the US is so much higher. Infant mortality is also significantly higher. Some of this comes down to sexism and how we deal with reproductive rights, but a lot of this also comes down to the access that mothers have to quality health care. So, have you ever worried about paying for health care? I want to jump directly in the chat because Rachel says, I'm here because every family I know is facing some kind of health crisis and in or in fear of a financial crisis. That's because getting sick can often be the financial crisis that affects a family. I feel that 100%. Part of the reason my wife and I like to save is so we are prepared for getting sick. If I were to get really sick, we would want to have that nest egg. And Ryan says, my in-laws are living in my living room with the Parkinson's and neurodegeneration. They worked 30 years for union and 20 years as a nurse and can't afford their needs. I fear the impact of healthcare costs in retirement. Absolutely. It's sneaking up. There are many more things you have to pay along with. And Ryan, that is crushing that they do not have access anymore. Like, absolutely rough. So, I mean, have you ever worried? I worry constantly about this. I have not gotten care at the doctor because of this. Retired, need to go back to work to afford health care, says Jacqueline. Uh, Catherine Lewandowski, who's in this call, who is our board vice chair, did exactly the same thing. So we lived that here through her. I could go deep on this, actually. I believe you. Do you want to share something out loud, Ryan?
Yeah, actually, I would. I just didn't want to take your time. Yeah, it's unfortunate, and part of the reason I'm doing what I'm doing in my personal life and pursuits is to help change it with our seniors and the boomer generation aging out. The situation is fiscally irresponsible in so many ways, and it burdens our general fund and ways because we haven't built reciprocal systems. We built extractionary systems for certain entities and certain winners, and that's a very minority part of our system. And the average affordable end of life care is $4,500 a month per person. That's not saying if you have neurodegeneration or mental health care, that can go up to like 9 to 10,000 per month per person. And collectively, my in-laws only bring in $5,500 a month. So me and my wife brought them into our house as a conscious decision for their quality of life. And we're not special. There are so many people that are doing it, but they're doing it in silence, or they're having to choose, unfortunately, to allow their loved ones to go into situations that are far lower than their dignity deserves. And if we don't collectively make a vocal change and a stand on that in one way or another, that is going to be worse when we get old. Like you were saying, like I'm looking at what's happening now saying this is completely unacceptable while knowing the timeline is going to be worse when I get there. So I think we really need to collectively be very staunch in our position here. And I'm so happy that you guys are doing what you're doing. So thank you.
Well, thank you for sharing. And I just want to say 10,000 for neuro issues. My dad had ALS 10 years ago, and my family was paying 30,000 a month. So, whew.
Exactly. Yeah. Oh, wow. Yeah. I sympathize.
Yeah, I want to read some other comments. Deborah said paid for Cobra coverage and the insurance lied about its coverage, which ended up being none. Goodness gracious. Ugh. Walter's 71 and has to keep working and can't afford to stop working due to healthcare costs and Medicare demands. And Walter lives in freaking Vermont, which should have had universal healthcare 20 years ago. So that makes me even more annoyed. uh, Matt just lost our insurance due to loss of employment, wading into the Washington Health Benefit Exchange to avoid premiums in excess of $3,500 a month. Holy smokes, that is rough. And Stanley is an HR1 concerned senior. Yeah, I would be too. Wiser is evil. And for those who don't know, HR1 and just this Health and Human Services, CMS, and everything has instituted an AI pre-authorization for traditional Medicaid or Medicare, sorry, to bring pre-authorizations into Medicare that didn't exist before, and basically just to deny care to seniors and save money. That's all that's going to happen. And so we've been fighting it, and Washington State is the #1 state in the nation fighting back against Wiser. All of our elected officials on one side of the aisle are united behind this, and we have a lot of support here. So uh, check out PISARA, Puget Sound Advocates for Retirement Action. They have excellent resources on Wiser. So let's jump forward. Oh, before that, I'm going to read Aowen's comment. I am chronically ill and not sure what is going to happen when Medicaid work requirements go into effect in January. Wow, yeah. My brother is going to lose insurance for exactly that reason. He also has issues, and yeah, I'm not happy about this. Yep. So Americans don't have healthcare security, and the big reason they don't is because nobody can afford premiums, and coverage is getting worse. And other countries don't have medical bills. This is not a reason people go bankrupt in other countries. Now, these numbers being zero is a slight fudge of the graphic. In most of these countries, it's like 10 to 50, but we're at 643,000. And depending on how you measure this, it's between 400 and 700,000 from what I've seen. We basically have more bankruptcies due to medical bills than every other country in the world, not any other country. So, talk real quick about HR1 cuts. Many of you are aware of these, but Washington is getting hit one of the hardest of almost any state in the nation. And the reason that is because Washington expanded care with the Affordable Care Act better than almost every other state. And with the rollback of the Affordable Care Act, healthcare is getting less affordable. As we've talked about, work requirements start on January 1st of 2027. I think a lot of legislators, as we go into the legislative session, which if you don't know, runs from January to April, A lot of legislators are going to start getting many angry calls and emails. And please, if you are in a position where you're being affected by this, send angry calls and emails to your legislators. We have also had ACA tax credits come in, which more than doubles the rates of those who are affected. Hospitals are already in crisis. We actually have allies at Prosperity, Eastern Washington, out in Spokane, that are following the paths of like 6 or 7 hospitals that are all looking to go down, which is very frustrating for the people there and scary for the people there. 40,000 people have already lost coverage from the exchange, which is a pretty significant portion, but they estimate that there's going to be a 30% drop in enrollment over time, which is just not acceptable. And our healthcare system, as it stands right now, is anti-business and anti-worker. Businesses are paying the cost of healthcare already. Already, employers are providing coverage to about 55%, a little more than half of Americans. Health insurance runs between 6 and 22% of payroll for the business. And many small businesses end up having to pay 20 to 25%, which is not affordable. And so small businesses only cover their workers under 30% of the time. And some regions also have no choice of an insurance provider, or their insurance providers don't actually cover the hospital in their area. And this is something I've dealt with my friends in Yakima, where they have one multi-care hospital in Yakima, and some people with their insurance need to drive all the way down to Tri-Cities or all the way up to Ellensburg to get any care because the local hospital doesn't take their insurance. Employer-sponsored insurance also traps workers. Like, people always say, oh, you lose your choice if you get a universal healthcare model. But my wife and I have one choice of carrier. It's not like we have a choice. This whole choice thing is maybe for the employer. Many workers can't leave their job without risking their healthcare coverage. At these town halls, I've heard from people who are like in that position where they hate their job, but they're like, I don't know what to do if I leave it. I might lose my medication and die. And you can also lose your job and lose your healthcare regardless of reason. See what happened to Matt, which there was a lost job in the family, and now he's facing $3,500 a month premiums. Like, crazy. And universal healthcare is better for unions. Countries with universal healthcare have higher union participation than the United States does. And there are plenty of other things for unions to argue for. One thing we hear is that for some unions, and Bob Hasagawa, our prime sponsor, he's a senator from South King County, he actually said that he spent more time arguing for healthcare in the union than for wages, safety, and benefits, which is not good. We would like to be able to argue for other things. And speaking of that, the Washington State Labor Council, we passed a resolution last year through our coalition, Healthcare is a Human Right, and we're going to be back there at the resolution or at the Washington State Labor Council this weekend, and we're doing a workshop this year. So we actually got a 3-day workshop where Healthcare is a Human Right is going to be there explaining the merits of universal healthcare for unions. And I'm very excited to hear how that goes. And it's a really exciting opportunity for us to have that position. So our healthcare system is unfair and perpetuates inequality. The parts of our state that are hit the hardest by the cuts to Medicaid are Central Washington, Eastern Washington, and honestly, the plateau or the Olympic Peninsula is getting really heavily hit by this. And it's where we have the highest Medicaid enrollment and Medicare enrollment. Just want to shout out in chat. Lizzie said my employer only offers United Healthcare. That's basically a non-choice. Yeah, that's not winning. The life expectancy versus income in the United States is extremely disparate, with women having about a 10-year gap and men having about a 15-year gap. Much of the male gap comes from addiction issues and firearms access, sadly. So why is it so bad? We all know money in politics. It's a huge deal. Healthcare spending is almost 18% of GDP, and it's expected to grow. Insurance companies are a $1.6 trillion industry. For reference, this is like 7% of our entire gross domestic product as a country is these leeches that are insurance companies. Big Pharma is another one, which is a $634 billion industry. It's smaller, but they exploit people in the United States spend 5 to 10 times what people in other countries do for similar medication. And we've also gone up against hospital and physician lobbying because hospital administrators and specialists, physicians, are benefiting from the current system and making more money than they would under a universal healthcare system. However, this is starting to change because um, general practitioners, your family doctors, they are not at all winning. Mental health professionals, unless they're only catering to the top demographic, they are not winning. So it this is changing. And I actually have friends in the Washington State Medical Association and other groups that are looking to change this idea. And HR 1's going to get steadily worse into the 2030s. This is the expected savings. It's the big savings are expected to kick in actually in the 2030s here. Unless, and this is where we start talking about the solution, we get universal health care. So, to define universal health care, this is from the World Health Organization definition. Universal health coverage means that all people have access to the full range of quality health services they need when and where they need them without financial hardship. I think that's a good definition. We love that definition here. It's what we want to implement. And the key elements found in successful models. I can tell you we are 0 for 5. We are for profit. We are privately funded. We do not have uniform billing. Our plans are a mess. We do not have essential health benefits. Many of people's plans cover nothing. And nobody is auto enrolled. You have to get a job or apply through the exchange to get health insurance. And universal health care is not something that is a crazy concept. And actually, Mexico just turned the good color, which is like green or blue, because they just fully stepped up their system to above us universal health care. And this is really the norm, universal healthcare. And what the US does is the outlier. In the US, it can be portrayed that it's different, but that just is not the case. And desire for change in Washington state is bipartisan. This was an EOI poll. They're one of our coalition partners, Economic Opportunity Institute. And the three questions asked, there was very little difference between Democrats, Republicans, and independents, even when the questions were like elected leaders and government officials should take action to reduce healthcare costs. The healthcare system in Washington needs to change. The solution these people might disagree on, but the desire for change, no disagreement there. So, a little brief history of universal healthcare in Washington. We almost had it back in 1993 under Clinton with the Health Services Act, but different people were elected nationally. It was repealed. The whole program was scrapped. So, our coalition partner, Healthcare for All Washington, said, no, let's not scrap this. Let's try to keep the dream alive. They started running the Washington Health Security Trust, which they still have written as a ballot initiative. They were not successful. They started switching to the legislature. And then they kind of stopped introducing the legislation. And that's where Whole Washington comes in. Whole Washington also started with initiative, and we're going to continue with initiative, shooting for 2028 for our next one. And we've run 3 initiative campaigns in the past. What's the issue with these initiative campaigns? A, they were too close together. B, 2018, we didn't really know what we were doing, and there was a certain epidemic that was happening in 2020 and 2022. And that COVID killed the 2020 and hindered the 2022 one. So we are very confident that we're going to be in a much better place to move forward in 2028. And we've also made huge strides in the legislature with introducing our legislation in both chambers, and we've introduced multiple transition bills. Talk more about those in a minute. So, what are we doing about it? First, we have the Washington Health Trust, which is a universal healthcare financing bill. It would create a universal single payer healthcare system, assuming the federal government played along. Otherwise, it'd be multiplayer between the federal and state governments. Doctors and hospitals would remain private. The Washington Health Trust does not affect providers at all. It would be a public insurance plan for all Washingtonians. Other countries with a similar system, Canada, Taiwan, South Korea. And one thing that we look at for a lot of hope is Canada didn't institute a national Medicare for All program, which is what they call theirs also. They call their National Health Service Medicare, until a state had done it first. It had spread to every province. So Saskatchewan did it in 64. By 74, every province in Canada had their own universal healthcare system, and it took until the 80s for the federal government to do so. So we see a similar type thing happening here where the states got to push. So what would the Washington Health Trust provide? Comprehensive coverage of medical, dental, vision, hearing, mental health, reproductive care. And there would be no deductibles, no copays, no networks, no denials, no bills, and zero out-of-pocket spending. This is something we've been very passionate about. You should not have to pay any money when you get sick. You can learn more on our website. Jess actually put in chat the full link to the text of the Washington Health Trust if you're curious and want to read it up on it. We are rewriting parts of it right now to reintroduce in 2027 because it's a new legislative session. But it's going to be very similar to what we have right now. This is real legislation. It's based on the Washington Health Security Trust that our partners at Healthcare for All Washington started way back when. And it also has a lot of language that was written by Senator Hasagawa as he was introducing it into the Senate. It's designed to align with federal Medicare for All, so this isn't a either or, this is a both sort of situation. It's been vetted by the Washington Employment Security Department and the Department of Revenue. Use Healthy San Francisco as a model to get around employer laws because there's a lot of really wonky federal employer laws that make universal health care very hard to pull off. And it builds on top of things like the Affordable Care Act, Medicare, and Medicaid. It also gets pretty A+ marks from Indian Health Services, and we actually have quite a few allies in the Indian health community. So no problems there. So how do we pay for it? And we're talking about a lot of money here. $25 to $35 billion is roughly what it costs to institute universal health care. And a majority of how we see to do it is from payroll. So this is our current language of our bill. So employers would pay 4.5% to 10.5% of wages, of which they could pass along up to 2% of that to an employee as a premium, sort of. And sole proprietors would just pay 2%. So the max any individual would pay is 2% of their earnings. I want to pause here and answer a question in chat. While I think everyone should be able to access healthcare, is there any phrasing in the legislation that limits who is eligible? Yeah, residency is the requirement. There are a few different definitions for residency, and we don't stipulate which one to use. So there's residency for work, which could happen right away when you get a job here. There's residency for colleges, which is much longer. If you move to a state and you want to go to the college and get the in-state rate, you actually have to wait something like a calendar year. And those are kind of the two ends of the spectrum. And then there's some residency definitions in between. We would leave it to the board to decide the board created by this bill, to decide which residency one makes sense. So I agree with you, Michaela. I think it's an interesting conundrum there. We also currently have a capital gains tax as part of our bill. We've been told that that is a political um, no-no. So we have been working with our allies in the more economic space to come up with different ways to fund the bill. So while we talk about this 25 to 35 billion that you would need to raise, the Washington Health Trust actually saves money. The savings from the Washington Healthcare Authority estimate between 800 million and 2.5 billion during implementation, up to $5.6 billion annually. Dr. Gerald Friedman, who did an analysis for us, estimates savings between $5 and $13 billion annually. And every study shows it being cheaper on a per time you go to the doctor basis. There's just no question that you break your hip, it's going to be cheaper to fix that if we have universal health care. So what's the cost before and after? I just made this. Currently, healthcare costs in Washington State are about 85 billion. And after, it'd be a little bit less than 85 billion. It is cheaper while covering more people with better coverage. It's a tough sell. So where does that savings come from? A huge amount of it comes from administration, provider administration, the biggest slice. Insurance administration, the second biggest slice. Market power. Where this market power really comes online is if Washington, Oregon, and California all get universal health care, combined risk pools. All of a sudden, the market power is off the chain, and we can start pushing down pharmaceutical prices and medical equipment prices. Then there's also fraud reduction. Simpler systems have less fraud. And a little bit on employer administration. Employers would no longer have to decide which health plan they're going to choose or run those calls that many of you have been a part of where your employer tells you what your health plans are going to be this year. That stuff all goes out the window. So how do we pass it? First strategy, legislative strategy. It requires a majority vote in both the House and the Senate, and we have to make it through several committees in both the House and the Senate. We had record co-sponsorship in the 2025-2026 session, and it is my belief that we are going to have significantly more, especially in the House, a lot more than 17 co-sponsors going into 2027 when we reintroduce. Now, our problem is we have two chairs that aren't, I would say, universal healthcare champions. Our chair in the House, I don't think he even considers it possible. Our chair in the Senate, Annette Cleveland here, she actually has said we need to get universal health care passed by 2030, and we would love to hold her to that. So we think there's a little bit more hope in the Senate for it to be pushed, and hopefully Annette can take us there. There are more ways to get support, and one of the ways we do is outreach. Many legislators just don't know that we have a good solution that they can sign on. We can also do things like electing universal healthcare champions, and I just put 3 down here that are candidates right now who have both endorsed Whole Washington and signed the Patients Over Profits pledge from National Nurses United. So the more people we elect like this, the more likely we get universal health care to pass. Sign me up, says Ryan. Yeah, please sign up. Whole Washington's bill progress. So we actually had 6 bills in 2026. We introduced the Washington Health Trusts in the 2025-2026 session, but we introduced in 2026 5 additional bills, one of which is removing the middlemen from Medicaid, no insurance companies administering Medicaid. Oh, did you already? Maybe I just forgot. Oops. Expanding Medicaid to 300% of the federal poverty level instead of 138%. This might have been too big of a jump, but giving more people health coverage is really what we fight for. Universal Healthcare Commission deadlines. I actually, from conversations I've had with legislators and from the Insurance Commissioner's office, I think this is going to have a lot of juice this year. I think we'll get a Universal Healthcare Commission bill passed. The Universal Healthcare Commission meets monthly. in Olympia at HCA's headquarters, and we talk to them every single time they meet. The single payer trigger bill, this bill actually passed through the Senate, which means it made it through the healthcare rules and was passed on the floor, actually entirely on partisan lines, before our favorite guy in the House decided not to give it a vote. Sad. Our constitutional amendment, which is our last one, is actually something Oregon passed back in 2021, which is an amendment enshrining healthcare as a right in the Constitution. And one of the exciting things about this is this isn't actually a transitionary bill necessarily. This is important before and after we get universal healthcare, because we still need to make sure that healthcare is a right in our Constitution. So, what's the real story? The legislature failed to act in 2026 here at the state level. They passed one healthcare reform bill this year, and all it does is create a 6-month notification period for corporate mergers in the healthcare space or private equity takeovers. And that was HB 2548. That was the only reform bill that passed. The other thing that kind of passed is the millionaire tax technically says it will be used for healthcare, but we don't really know what that means. There's no definition. Hopefully we'll get some clarity on that this session. So what's our support in the Senate? We have Senate support from these folks. This is Bob Hasagawa, our prime sponsor in the House. And Jessica Bateman, Mike Chapman, Liz Lovelit, and Tweena Nobles are also fantastic supporters. Sadly, we are losing my own Senator, Rebecca Saldana, to King County Council, maybe, if she wins the election. And so we are going to lose a person there, but hopefully we'll continue. When I emailed Greg Nance about Whole Washington, I got a reply his office had not heard of Whole Washington and would definitely look into it. Ooh, thank you for that lead. That is very interesting. Our support in the House right now is led by Representative Lisa Parsley, who is our prime sponsor in the House for the Health Trust, but also Sean Scott and Nicole Macri. Both fantastic champions. I actually talked to Lisa Parsley earlier today. She is very excited about getting the ball rolling on this. So what's Operation 2027? We're really, really in preparation mode right now. What are our goals? We got to push the legislature to act on healthcare in 2027. With work requirements coming in, we need to make sure it is a priority. We're already working with our partners on bills, both our partners in healthcare as a human right and our partners in the legislature. Bob Hasagawa is introducing stuff, and also Lisa Parsley are introducing other types of bills. We're also going to run the Washington Health Trust, or at least an amended version with more meat in it, as an initiative from May to December. So next year is going to be crazy, with January through December both having like a serious goal. So this is a very exciting time to be getting involved in healthcare justice. We're going to be very involved next year. So we're actively building a signature gathering coalition. One of our most prominent members is our friend Anna Jewell for Progressive Victory. They're a very young organization of very enthusiastic supporters who do a lot of great work. For the ballot initiative, what do we need? We need about 400,000 signatures, and we are almost definitely going to be doing an initiative to the legislature in 2027. It's all but decided at this point. The goal is to get on the 2028 ballot, which means we collect from May to December of 2027. It would go to the legislature at the beginning of the year in 2028. And then if they don't pass it, it would go to the ballot in 2028. What about in other parts of the state? Oh, we need signatures everywhere. I have friends in Yakima. We got friends in Okanagan. We got people out in Spokane, a very powerful team out there in Spokane. We're working on Tri-Cities. So we are working on other parts of the state. And PV is all over the state, too. progressive victory. So what are our priorities? We need to have enough volunteers to get on the ballot, signature captains, signature gatherers, all that kind of stuff. We need a large enough donor base to have multiple employees. You just really need that consistency of commitment from leadership to pull this off. And you need the people and infrastructure in every legislative district, every county, every congressional district in the state. I also want to talk about the Patients Over Profits campaign, which Matt put in chat, which we had a state launch for actually last week. And since that state launch, we've had something like 11 new signups, including, very excitingly today, Representative Obras said that he would sign it from the Kent area. And we also got one other one who is a sitting official from down in the Tacoma area. Forget who. Another priority we have, building out our new 501c3. Our 501c3 didn't exist before this year. We've been writing grants, and we actually got a Costco grant for $10,000 worth of event gear that we're going to be shipping out to our teams across the state. Very, very exciting stuff there. We need to increase our outreach. We need to partner with more organizations, legislative districts, and groups around the state. We want to create local teams in every county. We understand there are some limitations there. Some counties are less populous than others, but we would like to be in every county. We need to step up our game on social media. I'm on social media a lot. My face, not me as a person as much, to reach more interested people and recruit volunteers. And we need to work with student organizations and movements like Progressive Victory, like the Democratic Socialists of America, like the Working Families Party, like League of Women Voters, Indivisible Movement. There are a lot of allies that we can have in the space, but we need to do that outreach. And we need to build relationships with our legislators, building out a strong legislative team. I feel like we have a pretty good one right now. But working with candidates, this takes time. It takes time to get the meetings. It takes time to tell them what, just like the person above, Greg Nance, it takes time to get the meeting and educate Mr. Nance on getting the word out. And we have 50 new endorsements as of this year from candidates and elected officials. So universal healthcare is very much on the menu right now. Very, very exciting. So would you like to be part of the solution? This is the fun part. If you would like to be part of the solution, the first thing you can do is what Jess put in chat, which is join the whole Washington Slack. That's a great way to learn about what we're doing and stay up to date on what we're doing. You can just log into our Slack and see our asynchronous work schedule, see legislative updates, whatever is interesting to you. You can also pledge to sign our initiative. Very low bar. All you do is put in your information, and when we run the initiative, we will reach out to you. You can just go to wholewashington.org/pledge to do that. You can encourage legislators or candidates to support, or if you're a legislator, you can endorse and support. So you can send legislators or candidates our endorse page or the Patients Over Profits page. I've been doing this for like the last 2 months, and that's part of the reason we got 50 new endorsements. So it works, especially if you're a constituent. If you send it to your electeds, they are much more likely to listen. And if you secure a meeting with your legislators, feel free to invite me or our executive director to come. Do you guys have Julie Say from Mercer Island on your list for Patients Over Profits? We do. She is up there now. Very exciting. You can follow us on social media. We're on a whole bunch of platforms, like all of them. We have our own subreddit, which I definitely should have advertised this on. And I make a lot of YouTube content, Facebook, Instagram threads, Blue Sky, LinkedIn, the other ones. You can sign up to volunteer. Some specific needs we have right now, fundraising. We're trying to get better at that. We've traditionally not been very good at that. Writers. We really need people to write things like press releases, copy for our pages, for our flyers, things like that. And really, we need social media people. Right now, the social media page is kind of me. Uh, with a little bit of help from a couple other people, all of our pages. So I would love help. You can also, if you want to see more things to do, you can apply for a position at wholewashington.org/jobs. And there are different positions here. They're all not paid because, again, we need help with fundraising. However, if you need an idea of what kind of work you like to do, you can absolutely apply for a position by visiting this page. I signed a pledge in January 2025. Is this the same or something new? Oh, that is a really good question. If you have signed the pledge in the past, before like the last few months, you should absolutely sign the pledge again because we added some questions to the pledge, like would you be willing to collect signatures, which is a pretty important question. And so you can update your pledge and say yes or no to that question. Don't worry, you're not auto yesed. But if you have interest in being a signature gatherer for us, please pledge again or pledge for the first time. The last thing you can do is donate to our cause. I think the last thing, there might be one more. No, there's more. Donate to our cause, wholewashington.org/donate. We take ActBlue or Anadot, or we take tax-deductible donations through Butter. Or Give Butter? Yeah. And you can also print our lit and put it around. This is actually some outdated lit. We have much newer lit. wholewashington.org/print has all sorts of lit. And now we are to the end.